Hello, everyone, and welcome to part one of our lecture on Chapter 8 Substance Abuse and Mental Health Assessments. The reason why we talk about substance abuse, and mental health assessment in the context of this course is because both of these presenting concerns are prevalent in the clients that you are likely to see. Namely, it is estimated that approximately 20% of individuals in the United States are diagnosed with mental disorders in a given year. And of those, approximately half of the diagnosable cases occur by the age of 14, and about 75% of cases are identified by the age of 24. Furthermore, about half of the United States adults diagnosed with a mental disorder also have a diagnosed co occurring substance abuse disorder, really highlighting how prevalent both of these presenting concerns are for the individuals who we are all likely to see. Furthermore, the mental disorder prevalence rates are disproportionately higher for individuals who are transient or homeless, and those who are incarcerated, and accessing adequate mental health treatment is difficult for BIPOC individuals or Black, Indigenous, and people of color, as well as trans, non-binary, and sexual orientation diverse individuals. All of these groups disproportionately have inadequate health insurance and insufficient treatment options, which can then lead to the existence that we see where many of these same individuals report experiencing oppression in terms of the treatment settings that they're required to go to, language barriers, and higher levels of stigma. Collectively, when individuals of minority statuses do obtain mental health treatment, the quality of care is poor and perhaps more detrimental than not seeking treatment. This really highlights the role of a community needs assessment in the work that we do. Because a community needs assessment may be a useful part of the individual assessment process. This particular assessment typically involves an epidemiological analysis of the presence of disorder within the community and subpopulation, what culturally relevant resources may be available and to whom they are available, as well as a community's readiness to work with a particular subpopulation and in what ways. So, this community needs assessment can allow us the ability to work with our clients on an environmental level in regards to their mental health as well as their substance use. So, to start our discussion on Chapter 8, I want to go into more detail on the assessment of alcohol abuse. Around 8% of United States individuals aged 12 and older were diagnosed in 2014 with a substance use disorder. And the most commonly abused substances are alcohol, cannabis, non-prescription pain relievers, or a combination of these substances. And because most substance abuse involves alcohol, the majority of substance abuse assessments screen for alcohol misuse. Also, given the role of denial in reporting substance misuse, counselors need to be intentional and directly ask about substance use with all of their clients. According to the DSM, there are 10 recognized classes of psychoactive drugs that can lead to dependence, with the most common being alcohol. Other classifications or other classes include caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives, hypnotics, and anxiolytics, stimulants, tobacco, and other or unknown substances. And when we talk about these criteria in the context of alcohol, there are some specific terms that come in with the DSM. One of those being alcohol abuse, which can be defined as the failure to fulfill major roles at work or home, engagement in dangerous situations, and the presence of recurrent social and legal problems due to alcohol use. Overall, alcohol dependence includes these symptoms as well as the presence of increased tolerance and severe withdrawal symptoms. According to the National Institute on Alcohol Abuse and Alcoholism, they recommend using one basic question for all clients to determine whether further assessment is necessary in the context of substance use. Namely, they say as clinicians and as assessors, we need to ask our clients who are assigned male at birth who drink, how many times in the past year have you had 5 or more drinks in a day? And for those who are assigned female at birth, we ask the question as the number of drinks reduced to 4. Unfortunately, it's important to keep in mind that there are no norm bases for individuals who are assigned intersex at birth, and there's debate on how to ask these questions to individuals who are transgender and gender non-binary. And also, I know you all know this because you are in an addiction counseling program, but here's a breakdown of what a standard drink is. So now that we have this basis of what alcohol dependence and alcohol abuse looks like in the context of the DSM, I want to talk to you about a variety of assessment procedures that you can use to help evaluate alcohol use in the context of your initial assessment and in the work that you do with your clients. In most cases, the interview will probably be used to determine the nature and gravity of drinking problems, but some of these screening assessment tools can be helpful integrations into that interview. So some of these might sound familiar, you might even be using them now in your current work, and that's okay. But one of them is the CAGE questionnaire, which includes 4 questions to screen whether clients have ever believed they needed to cut down on their drinking, if they become annoyed when others ask them about their drinking, if they ever feel guilty about their drinking, or if they needed to drink in the morning to be alert or they needed an eye opener. There is also the CAGE Aid and the CAGE C, which are examples that include screening for other drugs and can be used in other settings. We also have the Rapid Alcohol Problem Screen, or the RAPS, which includes 4 items that relate to guilt about drinking, which is labeled remorse, blackouts, which is labeled as amnesia, failure to perform as expected, which is labeled as perform, and a need to drink in the morning, which they label as a starter, which gives us the acronym for RAPS. And research has shown that the Rapid Alcohol Problem Screen has performed better than the CAGE in detecting alcohol abuse across gender and racial and ethnic groups. So you have these options where, although they may be similar, they both have a 4-letter acronym that helps you identify problematic alcohol use. They can be used differently depending on our clients' identities. We also have the Michigan Alcoholism Screening Test, or the MAST, which is a 24-item instrument that assesses symptoms of excessive drinking, problem with daily functioning, concerns expressed by others about alcohol abuse, and the degree of success an individual has in trying to control or stop their drinking. The Michigan Alcoholism Screening Test has a shortened version as well as its generic version, so you can use them depending on how much time you have with a client and how much detail you need. And we also have the Substance Abuse Subtle Screening Inventory, or the SASI, which is in its 4th edition. So it's oftentimes called the SASI 4, which is a comprehensive screening tool for detecting substance abuse, especially amongst those who may be defensive or deny any problems that they have with alcohol. And it contains 10 scales that evaluate the abuse of alcohol and other drugs. There are versions of the SASI for adolescents that are in Spanish and in American Sign Language. We will learn a lot more about the SASI 4 in the second half of the course because it's going to be utilized in the assessment that we are going to be discussing. And we also have the Alcohol Use Disorders Identification Test, or the AUDIT, which is a 10-item screening tool for detecting alcohol dependence and its consequences. It screens for 3 levels of drinking with score thresholds to identify low and high risk drinkers. And there are 2 shortened versions of the AUDIT 3 and the AUDIT 4, that are available. A lot of agencies will use items such as the AUDIT or the MAST or the CAGE or the RAPS when screening individuals for alcohol abuse because they're free. Whereas the SASI does require a subscription and payment for each administration. So it's something to keep in mind in terms of access for your clients so that you can pick the assessment that makes the most sense for them. There are some additional assessments that you can also use. Those include the Addiction Severity Index, or the ASI, which investigates clients' alcohol use in the context of interpersonal and intrapersonal functioning. The ASI has alternative versions, including the multimedia version, a follow-up version, an adolescent version, and a more extensive drug assessment version. We also have the Comprehensive Drinker Profile, which is a structured intake interview that is available in shortened and follow-up versions. The Comprehensive Drinker Profile assesses current and historical abuse of alcohol and its consequences. It typically takes between 1 and 2 hours to complete the interview, so this particular profile is good if alcohol is the client's only presenting concern. And then we also have Timeline Followback, which explores drinking or other drug use behavior over a 1-year period to explore patterns in behavior or associated problems and the intensity of such behaviors. And we also have the Alcohol Use Inventory, or the AUI, which contains 24 scales that evaluate patterns of behavior, attitudes, and symptoms of alcohol use in individuals who are 16 and older. It is most appropriate for individuals who enter a treatment program as a result of alcohol dependence or abuse, and it can be used to establish a treatment plan for a person with alcohol-related issues in that context, so in the context of being admitted into a treatment program. And then finally, we have the self-monitoring methods, which are tools that you discover or use with your client. You develop them in conjunction with your client to help the client monitor their own substance use. And self-monitoring methods can be really helpful for clients if they're motivated to engage in like the homework assignments that you're providing them, but they're most often used as a supplement to more formal assessment procedures that you do with clients. So similar to the initial inventory screeners that we discussed in Chapter 7, I present these different assessments to you for alcohol use and throughout the rest of Chapter 8, not as explicit things that you need to remember, but rather I want to present to you the wide variety that we have available to us in assessing our clients for alcohol misuse. And we can use different assessments depending on our clients' presenting concerns, and really navigating and tailoring the assessment experience to who they are as individuals. Also, a key component of substance use assessment is motivational interviewing, which is a guided assessment that counselors can use to assess clients who may be less ready to change their behavioral patterns, and is commonly used in substance abuse assessment and interventions. I know that y'all take an entire course on MI, so I am not going to spend a lot of time going over this, and I encourage you to go back to your notes on whoever taught your course and to figure out more about it. But keep in mind that there are 4 guiding principles of motivational interviewing, which includes expressing empathy through reflective listening, developing discrepancy between a client's goals and values, as well as how that is discrepant to their current behavior, rolling with the resistance that the client may have around maintaining the status quo of ambivalence, and supporting the self-efficacy by conveying to clients that they are capable of making change. So that is where we are going to pause part 1 of our lecture on Chapter 8, and join me in the next lecture where we're going to talk about more of the mental health assessments that are available to you. I will see you all in the next lecture.